Mr. Christie Souza.
Sir, this bill does not just implement the CareShield Life scheme. It also enables the ElderShield scheme to be administered by the government instead of private insurance companies. It provides for the withdrawal of Medisave funds of persons who are severely disabled. It establishes the long-term care fund and puts in place offences and penalties. I will speak in favour of all these four aspects of the bill successively. Firstly, this bill transfers the ElderShield scheme from private insurance companies to government administration, similar to how CareShield Life is also government administered. This has several advantages. The not-for-profit admin increases the affordability of premiums. The centralization of administering the scheme will streamline the application for payout process. It also allows for smoother transition for those who choose to shift from ElderShield scheme to CareShield Life scheme. It also allows for the funds to be combined into a single CareShield Life and ElderShield insurance fund. This allows for more flexibility in investing. Even as the monies are consolidated into a single fund, how will the Minister ensure intergenerational equity in how the schemes are administered? That is one question I have. In relation to the transition from ElderShield to CareShield Life, will the Minister provide an indication as to when and how sign-ups can begin? Also, will supplement schemes for ElderShield be affected by the transfer of ElderShield to become government-administered and change of coverage to CareShield Life instead of ElderShield, should the policyholder choose to shift over to CareShield Life? Secondly, sir, Clause 66, subsection 5, provides for the withdrawal of Medisave funds of persons who are severely disabled. Because healthcare can come in many forms, this flexibility is valuable for families to have yet another place of resources to tap into care for the severely disabled. But even as there is increased flexibility, it should not deplete from Medisave funds to the extent that Medisave is no longer useful for its intended purposes. This is especially acute where a child's Medisave funds is used to pay for a parent's medical expenses, and the child has his or her own expenses to cover, and as a result of not marrying, the child does not have anyone else's Medisave account to tap onto in the future. Therefore, would the Minister address these concerns? Furthermore, the new Section 16B(1)(a) of the Central Provident Fund Act, found in Clause 66, indicates that there is a minimum sum in the member's account in order for cash withdrawals for long-term care to be allowed. From news reports, the minimum sum that is being looked at is $5,000. Would the Minister explain how this figure was derived such that it ensures that the account holder still has money to pay for other healthcare needs? Thirdly, Part 10 establishes the Long Care Support Fund, which is used for premium subsidies and other long-term care-related assistance as set out in Clause 39. Would the Minister share with us what are some of the plans that the Ministry has in utilizing the funds for purposes other than subsidizing CareShield Life premiums? In particular, what kind of assistance will there be for those who are severely disabled but have utilized the 6 years under the ElderShield scheme, those who are unable to purchase the ElderShield scheme because they had been severely disabled, and those who are low income and do not have much in their Medisave account? How does the Minister seek to address these perceived gaps? Fourthly, this bill introduces offences and penalties for the administration of the scheme. Clause 49 criminalizes the act of an assessor making a fraudulent disability assessment. As the integrity of the administration of CareShield Life and ElderShield schemes rests primarily on the disability assessor, this offence places a safeguard against fraudulent claims facilitated by disability assessors. Clause 50 criminalizes the act of using the payouts for not applying the funds for the insured person first. The new Section 16B(10) of the CPF Act also has a similar offence. This offence ameliorates the risk of cash outs or cash payouts being misused. Because the person directly harmed by the act criminalized by this offence is the insured person or member, why is it that a portion of the penalty be returned to the insured person himself or herself instead of having the whole penalty being paid into the CareShield Life and ElderShield Insurance Fund? Because the penalty is possibly more than the amount misused by 4 to 8 times, requiring the offender to pay the insured person or member would not remove the punitive quality of the penalty. An exception to the offence is reasonable excuse, because different households structure their expenses differently, such that it may not be very clear whether the payout was used for the insured person or member first. Would the Minister give some examples of what a reasonable excuse might be? Even as this bill seeks to provide some financial support for long-term care, financial support is only one side of the equation to ensuring that long-term care remains affordable. Another side of the equation is to expand the supply of long-term care services. This is especially important as the number of persons who are severely disabled is projected to increase to 69,000 in 2030 compared to 29,000 in 2014. That is about a 140% increase in demand for long-term care services or long-term caregiver training. Would the Minister elaborate on the plans to ensure that we have sufficient personnel and facilities for this increase in demand? Because technology can help caring for severely disabled persons less physically demanding, how has Singapore been investing in such technology to reduce the reliance on foreign manpower and to allow those who work in this physically demanding field to enjoy a longer, meaningful career? Also, what efforts have been made to make certain assistive technologies more accessible to families who may need it to care for their loved ones? Sir, during this debate, there have been a number of broad criticisms against our healthcare system. In my view, however, we have, in broad terms, a good system in place. Is there room for improvement? Sure. But let's also acknowledge the merits. Where provision of fiscal measures to support a sustainable healthcare model is concerned, where good quality doctors are concerned, and where a professional and hard-working nursing population is concerned, I think Singapore ranks well and does well. Singapore has been independently assessed as being second in the 2018 Bloomberg study on most efficient healthcare systems. That is, good outcomes, but reasonable costs. So I hope we can put things in perspective in this debate. In conclusion, Singaporeans have been fortunate, some may say blessed, with long lives, with our life expectancy one of the highest in the world. But often with long lives, though not necessarily so, comes with it some loss of the kind of life as we knew it. Needing to rely on others to carry out activities of daily living does not just affect the elderly, but also affects people from all ages. Through it all, the recipient of help is still valued and valuable. This CareShield Life and Long-Term Care Bill helps support them and their families. By pooling the risks among many in society, they may be able to receive more than they would have in their savings otherwise. By allowing spouses to tap onto each other's Medisave account, another resource to support each other through the difficult time is opened. By setting up the Long-Term Care Support Fund, there can be more support for those who need more help in financing long-term care options, whether it be through subsidizing premiums or through other schemes. Because this bill implements and commits to the caring for those who are severely disabled, and for the reasons that I have stated, I support it.